is a viral infection that attacks the liver and can cause both acute and chronic diseases. The virus is transmitted through the contact with the blood of or any body fluids of an infected person. WHO estimates that more than 780,000 people die every year due to the consequences of hepatitis B. This has pegged it as a potentially life-threatening liver infection and a major global health problem. GBC 24's Rebekah Awuah finds out more about the disease, whose prevalence is highest in sub-Saharan Africa and East Asia.
The hepatitis B virus is a DNA virus belonging to the Hepanavirinae family of viruses. The breakthrough understanding of hepatitis came in 1963 when Dr. Barash Bloomberg discovered an antigen that detected the presence of hepatitis B in blood samples. Hepatitis B is an infectious illness caused by hepatitis B virus, thus the HBV, which infects the liver and causes an inflammation called hepatitis. Originally known as serum hepatitis, the disease has caused epidemics in parts of Asia and Africa, and it is endemic in China.
There are so many causes of inflammation of the liver. Sometimes it could be due to drugs we take. Other times it could be due to chemicals, and alcohol can also cause hepatitis.
About a third of the world's population, that is, more than 2 billion people, have been infected with the hepatitis B virus. This includes 350 million chronic carriers of the virus. It has therefore become a potentially life-threatening disease that is attracting global attention. This is due to the fact that it is an important occupational hazard for health workers and can cause cirrhosis of the liver and liver cancer.
There are different modes of transmission. It could be a pregnant woman who has a virus, and then through pregnancy, through labor and delivery, pass on the virus to the baby. This is what we call perinatal transmission or vertical transmission. Other times it could be through blood transfusion, especially if the blood is not well screened. But most of our blood, almost all the blood are well screened, so the risk is reduced. People who use IV drugs, by IV intravenous drugs, who abuse them, they share needles, and by so doing, if one is infected, that person can transmit the infection to the other. The other way of acquiring it is also through tattoos. We see most people having tattoos on their skin. If these needles are not well sterilized, it predisposes them or puts them in a danger of getting hepatitis B. The other mode of transmission of the viruses, especially in women during pedicure, manicure, or the men when they go to the barbering shops and they don't have their own razor blades and they use the commercial, the public ones, that can also put them at risk of getting the infection.
She indicated, however, that the hepatitis B virus is not spread by contaminated food or water and cannot be spread casually in the workplace. Touching on who is at highest risk for the disease, she noted that the likelihood that infection with the hepatitis B virus becomes chronic depends upon the age at which a person becomes infected. The WHO says more than 90% of healthy adults who are infected with the hepatitis B virus will recover and be completely rid of the virus within 6 months.
Most people do not have any symptoms at all. I mean, they are fine. The only time they get to know they have hepatitis B is when they go and do the test, and then it comes out as positive. Others may have what we call an acute infection, where they feel very sick, they feel very weak, they have joint pains, and this is then followed by jaundice, that is yellowish discoloration of the eyes. So these are the acute symptoms. And those who acquire the infection, usually if it's in the adult age, may have these symptoms. Others may not have any symptoms at all. So that is why sometimes the disease people like say it's a silent killer because you don't know, and the only time you are picked up is when you get complications. But if it goes on and they develop the complications of cirrhosis, then they notice that their feet are swollen and their tummies are swollen, what we call ascites. So this may be some of the features of chronic hepatitis.
The news team then hit town to sample public opinion on the disease.
I've heard about hepatitis B. I know as sexually transmitted disease, which can also be acquired through sweat. Yes, and it affects the liver. We have the acute and the chronic. Yes, we have the A, B, and E. And the B is normally rampant.
If somebody is having this kind of sickness, and let's take it, you are all sitting in a car and the person sweat is having this kind of sickness and the sweat touch your body, you can get hepatitis B. You can get hepatitis B through deep kiss. If somebody is having hepatitis B, you should stay away from oil food, canned food, this kind of canned food. Stay away from alcohol, eliminate fat, but almost take more water and take this kind of fruit juice. But I advise people that if you want to take fruit juice, it will be better that you have to blend the fruit yourself.
Is having it and you kiss the person deeply, or sweat, or eating with the person, you can have it. But I can't tell how the symptoms are.
I know it's symptoms that can easily connected through sweat. And I've experienced that we don't have any treatment for it. So if I may ask, at least, what can we do to protect that virus or hepatitis B?
Treatment is not readily accessible in many resource-constrained settings, and also there is no specific treatment for acute hepatitis B, says the WHO. Instead, care is aimed at maintaining comfort and adequate nutritional balance. However, with the help of a vaccine, hepatitis B has since 1982 become a preventable disease. The vaccine is said to be 95% effective in preventing infection and its chronic consequences. Advocates advise against the reliance on herbal treatment in the event of infection, as reports indicate that most patients seek cure from these herbalists.
Management of hepatitis in this country is very challenging in terms of cost. When we take the various investigations that we do, just the investigation may cost you between 600 to 800 Ghana cedis just for the labs. And it is not captured in the health insurance. People have to pay out of their pockets. And when it comes to treatment, it's also very expensive. We have the injections and we have the tablets. Currently, the injection goes for 600 Ghana cedis every week. And one person is supposed to take it for a minimum of 48 weeks. So if you have the virus and you require treatment and you have to be on the injection, then you are going to pay about 600 Ghana cedis every week for 48 weeks. So it makes it very challenging for our patients. Usually those who are put on the tablets are not easily available. They are also expensive. And the other thing is that if you are placed on the tablet, you have to be on it for a very long time, in some cases for the rest of your life. And these drugs are not covered under the health insurance. So most people have it, they require treatment but cannot afford. So they are just working with the virus.
Hepatitis B is a very common infection, especially in sub-Saharan Africa, including Ghana. WHO says any country whose hepatitis prevalence hits 8% is hyper-endemic, and it is an area where the virus is common. Currently, Ghana's prevalence rate is about 12 to 15%. This means that every 12 out of 100 people may carry the virus, compared to HIV, where 1 to 2 people out of 100 are infected. This therefore raises cause for concern.
Stigma is a very big problem because if people are not well educated, if they don't understand the pathogenesis, how it all comes about, they tend to stigmatize. But one thing is that hepatitis B is preventable by having a vaccine. So though we say that it can be dangerous, it is also preventable, unlike the other viral diseases like HIV or hepatitis C. So the recommendation is that people should go for the test, and if you are negative, you go for the vaccine to protect yourself. In talking about one's diet, it depends on whether it's acute or chronic. If it's the acute type where the person is deeply jaundiced, the person is very sick, at that particular time, we ask them to stop all protein, like meat, fish, eggs, and then we encourage them to take more carbohydrates. in terms of our banku, in terms of rice, in terms of yam, plantain, etc. Because the end product of this is glucose. So we encourage them to take in lots of fluids and to have bed rest. Once the jaundice is cleared and they are much better, they go on their normal diet. People who have chronic hepatitis B do not have to change their diet. They can be on the same diet, but we ask them to avoid alcohol. We advise them to stop smoking if they are smoking and to stop taking drugs that are unnecessary. Most of our herbal medications, we ask them to stop taking them as well.
Dr. W.H.O had a word for the public and appealed for government support for infected individuals.
With the public, I will advise that we take what we call universal precautions. Whatever you do, you need to be cautious. But there's one thing you should know. Casual contact. What I mean by casual contact is like shaking somebody, sharing the same spoon, plate, eating together in the same plate will not transmit the virus. Neither will kissing transmit the virus. I'm not encouraging people to kiss anyway, but it will not cause an infection. So if you know your status, if you know your hepatitis B, please go for the vaccine to protect yourself. Prevention, they say, is always better than cure. And the vaccine is 15 Ghana cedis per a month, and you need only 3 doses. So the total vaccination is about 45 Ghana cedis compared to paying 600 Ghana every week for 48 weeks for treatment. So prevention in this case is very vital. The fortunate thing is that children, for the last 10 years, we have what we call universal expanded program of immunization. So children who are less than 11 years, who went through their weighing or had their vaccinations, have all had the injection because it's part of the vaccination we do, or what we call weighing that we go for. So for our little children who've gone through the weighing, who've had all their injections, they have had the vaccine. Now we also appeal to the government to come to the aid of people who have the virus, who really need treatment. Because of the cost of investigations, cost of treatment, most people will need treatment but cannot afford. So we are appealing to the government, we are appealing to health insurance if they can consider investigating and treating on the health insurance scheme.
For now, in developing countries, most people with liver cancer die within months of diagnosis, whereas in high-income countries, surgery and chemotherapy can prolong life for up to a few years. The hepatitis B vaccine is seen, therefore, as the mainstay of hepatitis B prevention. Advocacy must be stepped up to prevent and control viral hepatitis, promote partnership and mobilize resources, formulate evidence-based policy and data for action, prevent transmission, and promote access to screening, care and treatment services.
Hepatitis B is the inflammation of the liver, and we are interested in this public health because we want to sensitize Ghanaians about the disease and make sure that people know about it so they can do something about it.
The WHO's initiative of organizing World Hepatitis Day on July 28 every year to increase awareness and understanding of viral hepatitis is a step in the right direction, but more can be done to reduce the menace to the barest minimum. Rebekah Awuah reporting for GBC 24.